questions and the discussions. And because there is time constraint, so I am going to start. So my topic, as you know, that is the cardiac rehabilitation following coronary artery bypass grafting. As we know that the coronary artery disease is a cardiac abnormality that is related to the narrowing of the coronary arteries that supplies the heart, and worldwide it is the 85% of the total cause of the death all around. And coronary artery bypass grafting is the cornerstone of managing the coronary artery disease with lot of indications. We are not going to go into detail. And there was a debate that particularly that came from the cardiologist side. Is there a role of cardiac rehabilitation after coronary bypass grafting? They said the patients has well accepted the procedure, and initially they do take the count to, for follow-up, all these things, take over all the pains to go into the surgery, and later on, but in the long run, they cannot sustain the whole thing. And that is the cornerstone of our introduction. And this is showing the different indications, right from the left main to multi-vessel disease. Even for single vessel disease, we can do the coronary bypass grafting if it is osteoproximal. And where is the role of why we are dealing about the cardiac rehabilitation? And as defined by the American Heart Association, the term cardiac rehabilitation refers to coordinated, multifaceted interventions designed to optimize a cardiac patient's physical, psychological, and social functioning, in addition to stabilizing, slowing, or even reversing the progression of the underlying atherosclerotic process, thereby reducing the morbidity and mortality. That is the main goal of the rehabilitation. Indications of cardiac rehabilitation in ischemic heart disease following acute coronary syndrome, perfect transluminal angioplasty, even surgical myocardial revascularization, stable coronary disease with multiple risk factors. And in cardiac surgery, most often we are offering this for the coronary bypass grafting, valvular heart disease, and heart transplant patients. Among the different studies have been done. As there was a question whether there is any role of cardiac rehabilitation following surgery. So I have gone through a lot of literatures, near about 50 articles supporting that it is now a class 1 indication with class of evidence is A. Previously it was posted to 2B. Now it is class 1 recommendation with evidence is A. So it is to be accepted for all patients. So cardiac rehabilitation has shown significant advantage for post-CABG patients. Advantage is that it reduces 30% of the mortality reduction, acceptance rate, and returns to normal life, it augments. And also it reduces the risk factors, like it helps us to reduce the lipid profile, dietary habit, and exercise preponderance to the lifestyle changes. All these things, how it helps. There are several strategies that we take over for the rehabilitation. One is the routine physical exercise and medical treatment, adherence to the drugs. Many often patients, initially they accept the drug regimen, but later on, I have got the patients follow up for near about 10 years. Some patient was lost to follow up for last 2 years. They said, no, I'm not taking. Even we have got the patients, very renowned neurosurgeon was operated 20 years back. Last night I met him in the lift while he was coming from the operation hospital. He said, I'm not taking anything. Simply I'm taking a anti-lipid drug. Even he doesn't take the antiplatelet drug. So the core components of cardiac rehabilitation is to patient assessment. Who are supposed to be sent for cardiac rehabilitation, nutrition counseling, and weight management, very important. I was 86 kilo weight, now I am 66. I have reduced. That must help us. Nowadays I am finding our colleagues led to the coronary disease. So that has definite role over management of the development of the disease and in helping the, sustaining the result of the treatment of the disease as well. And blood pressure management, lipid management, diabetes management, tobacco cessation, very important. And what I do for the patients with tobacco, if they start, I I never touch the patient for surgery if they don't show me that they have to be honest. I am honest and they have to be honest. I tell them how many days you are not without smoking. If it is not less than 2 months, I don't tell them to come for surgery. One patient was suffering from COVID-19. He was 70% lung was involved. So he was managed well, so pre-protein assessment. And later on, after 2 months, he was found to have the lung function has come back. And then she was only a 38 years old lady. So, and then we posted her for the CAG and then did the operation. Now it's been 2.5 years. In the COVID era, she was operated, not done well, because she has reduced her weight, she has, doing very good exercise in every morning. She does everything in her house. And the people in the house are now not accepting her because she does everything in the world. Because they said, you undergone CABG, so don't do work. But I said, let her do work, because I tell them, if you don't like to come back to your normal life, or if you don't like to go for more augmented life, don't come for operation. If you want to come on sustaining your life with the disease, don't go for surgery. But if you would like to come back to your normal life, then come for surgery. That is, taken as a oath before surgery. And physical activity, counseling, and exercise training, all together around the life. So physiology of physical exercise, each of this very complex thing. I'm not like, because the time constraint, we can do resistance exercise, aerobic exercise, not going in detail. And we have got the 4 phases of cardiac rehabilitation. First phase in the inpatient, that is the pre-CABG procedure. Right before surgery, they are brought for respiratory physiotherapy, and then they are brought for the, and then second phase in the rehabilitation outpatient, that is the first step. Then for longer period, for up to 24 months, and fourth rehabilitation up to the unlimited time till death. And worldwide, surprisingly, the rehabilitation program is now 38% of the whole world that has the rehabilitation program, and 68% in the high-income countries, and in 83.3% in the low-income countries. Fortunately or unfortunately, our country don't have that structured program. But I was very blessed to attend a cardiac rehabilitation workshop that was in 2002. That was the last program that was organized in the country. And that was from the 7th Asian, here the Shuman Nazmul Hussain Sir is here. He was one of the organizers. And the Professor Jalal Sir was the director of NICBD at that time, 2002. He took all the, because he was a, clinical cardiologist. So they wanted to all these things. So this is all about what she's showing. And now I'm going to show you that the recommendation is now class 1, and so we have to adopt it. These are different patients that we operated. So benefits of rehabilitation following bypass surgery is structured medical supervised exercise program, and heart healthy diet, education, and professional support system. But if you can have a good rapport with the patient, what I do, I have got the phone number of all the patients. I can recall everybody by their all details. So many of them, if they are not come for follow-up every 2 months, I give a call. And I ask them, don't need to come to me. After 6 months, at least 6 months, if they are 5 years and beyond, then I tell them every 6 months you do your lipid profile, you do your blood sugar if you are not diabetic. If you are diabetic, you have to do it every fortnightly, check your blood sugar. And do exercise every day. Morning you start your day with a half an hour walk, or in the day of before you go to sleep, go for sleep after walking half an hour. So this the adherence that brings the adherence. These are the flow chart that how we can start in the, even I start the rehabilitation program right from the intensive care unit. When they are brought for extubation, then I check them, because I have taught them before surgery how to do the hand exercise, leg exercise. If they are not, can do, we don't even extubate. So just after extubation, I tell them, you go on doing your exercise and breathing exercise, leg movement, dorsiflexion, plantar flexion. Later on, we don't allow them to go for vigorous exercise up to 4 to 6 weeks. Then they should go back to their normal life. If they come for go back to their office or whatever job they do, I allow them after 2 months go and do. Even those people, even I have got the imam person. He honor of a mosque.
Dr. Yeah, Dr. Mohammad Faizul Islam, thank you for your excellent presentation. I think this is a very good time for question and answer session. The time is very much limited. Is there any question from the audience to Dr. Faiz? Yeah, please.
I want to I want to say the last word. I want to memorize one hadith that was said. The Hazrat Muhammad Sallallahu Alaihi Wasallam said, "Ala wa inna fil jasadi il mugdata ida saluhat saluha jasadu kulluhu wa ida fasada jasadal kulluhu." He said, there is a flesh in your heart, in the body, that is heart. If it remains okay, you are okay. If it is spoiled, you are spoiled. So we want to have a healthy heart. And then I want to show you that the Colgate said, if you are strong inside, then you can smile outside. Thank you very much.
Yeah. Any question, only single question can be accepted.
Right. That's the
Okay, now I think that we don't. You can discuss personally to get the very good clarification regarding this issue. Now I'd like to invite Dr. Shaukat Gupta, who is going to present the mini ascending aortic replacement. Dr. Shaukat Gupta from Iscard Hospital Limited. Please maintain your time. Try to maintain it.